On this episode of Healthline, we are talking about the leading cause of death, heart disease. We'll also discuss the signs of cardiac arrest and reveal some shocking statistics about who's at risk. Then later in the show, we'll demonstrate how to properly give CPR and how to use an automated external defibrillator. You've seen them and probably didn't know what they were. That's next on Healthline. Welcome to Healthline, everyone. I'm Lynn Vaughn. Most of you probably know someone who has died from a form of heart disease. It is the #1 cause of death globally, and of course that means right here in Fulton County. Joining me to talk about the issue is the Executive Director of the Better Outcomes Foundation. He's Mr. Michael Charles. Mr. Charles, welcome to Healthline.
Thank you. Thanks for having me.
First of all, tell us about the Better Outcomes Foundation and what you do, what you teach.
Sure. I'm going to answer that by talking about the issue that the foundation addresses. The best chance of a victim surviving out of hospital cardiac arrest is getting immediate bystander CPR and AED. In Fulton County, the average bystander CPR rate is about 40%. That's the average for the whole county. It's different in different communities. In high-risk communities or at-risk communities that are defined by geography and their demographics, if the neighborhood of the community is 80% African American, Hispanic, or mixed race, if the median household income is less than $40,000, and if the 20% of the population is less than high school diploma, it's considered at risk, and the sudden cardiac arrests are higher in those neighborhoods, and the incidence of bystander CPR are lower. So in the northern end of the county, it may be as high as 60%. In the lower end of the county, it may be as low as 30%. The average is about 40%.
Okay,
so the Better Outcomes Foundation, its mission is to direct the education and the training into those at-risk communities in terms of sudden cardiac arrest awareness, CPR, and AED access.
Okay. Tell us about the causes of heart disease all around the world. What are the top 10 reasons for people experiencing heart disease?
Well, the #1 leading of heart disease, coronary artery disease, of all subgroups of heart disease is the leading cause. It's, in terms of globally, 7.25 billion people in the world, 56 million deaths from all causes annually. Of those, the largest single segment is cardiovascular disease at 17.5 million deaths.
And we get that how? People get the cardiovascular disease?
Oh, from both its lifestyle, what we eat, what we smoke, what we don't exercise. Some of it is genetic, high cholesterol, hypertension, obesity, diabetes. Those are all contributing factors toward cardiovascular disease and heart disease.
And when it comes to Fulton County, what's our death rate from heart disease?
Our death rate from heart disease, well, there's 1,426 deaths from heart disease in Fulton County every year. It's the #1 leading cause of death in Fulton County. Whatever in second place is not even close. And it's the same risk factors that I mentioned globally or the same locally.
Now, you were telling me earlier that that is different from cardiac arrest, and now I understand there's also non-cardiac arrest. So tell us first about cardiac arrest.
Okay, in terms of the difference between cardiac arrest and heart disease, well, heart disease is the global term for all heart disease, which doesn't necessarily involve being unresponsive, don't have a pulse, and not breathing. That's the characteristics of cardiac arrest. Different from heart attack. You can think of it in terms of heart attack as a plumbing problem. There's a blockage, and the person has chest pain, death of heart tissue, but they remain conscious. They still have a pulse and they're still breathing.
Okay.
In cardiac arrest, those same things may occur, but the person is unresponsive, unconscious, not breathing, doesn't have a pulse. The difference between sudden and non-sudden cardiac arrest is essentially timing. Sudden means it was witnessed and the signs and symptoms of the distress were within an hour of the collapse. That's sudden cardiac arrest for witnessed events. For unwitnessed, you find a person unresponsive, not breathing, not have a pulse, and 24 hours ago they were seen well, that's sudden. Anything outside of that, if it was longer than 24 hours ago, not sudden.
So it makes sense then that the quicker somebody can get to someone who has collapsed, the better off that person is.
Sure.
Obviously. Well, what about the ages of people involved? Many of us think that this is something that happens to people in old age.
Yeah, that's a common myth. The actual median age for sudden cardiac arrest is 65, meaning half of them occur before 65, 64 all the way down to birth, and half of them occur after 65. The greatest single segment is 50 years old to 64 years old. 30% of them occur in that age range. So it's not exclusively or even primarily an old or elderly person's disease.
Okay, and what jumps out at me is that you said all the way down to birth. You mean that children can actually experience
the
this?
The peak point of, one of the peak points in sudden cardiac arrest is from 0 to 6 months.
Wow.
SIDS is a form of sudden cardiac arrest. So it peaked from 0 to 6 months, and then the other peak is beyond 85.
Okay, now I don't want to put you on the spot,
Okay.
but I know that kid, it's a 0 to 6 month old doesn't have the lifestyle problems. I wonder what causes that. Do we know yet?
Well, the reasons for SIDS are unclear. I mean, it's a matter of ongoing research and study as to why that is, but it is unresponsive, not breathing, and not a pulse, and that by definition is cardiac arrest.
Okay, and the statistics for those over 18, what are they?
Over 18.
18 to 24, excuse me, 18 to 64 age
yeah.
group.
Yeah, it's about 167,000 per year in that age group experience sudden cardiac arrest. Now, those causes are typically coronary artery disease or some sort of dysrhythmia. The younger you are, it tends to be dysrhythmias in the heart, or thickening of heart wall muscle is found to be the leading cause in young people and teens, athletes, that sort of thing.
Mm-hmm. Maybe it would be a good time now to find out what a person might sense or feel if he or she is having a cardiac arrest.
A lot of times I don't remember anything. The ones that survive and revive, you ask them, they've lost memory for that entire day.
Wow.
So they don't remember the collapse or the signs and symptoms. Now, of course, other people around them remember, and it could be chest pain, dizziness, shortness of breath. Fainting is a big one. Fainting is a sudden collapse or feeling like they're going to faint is a primary indicator. But the victim themselves has no memory. The survivor has no memory of it, typically.
So since we know, and it's generally well known that CPR can help, why isn't it practiced more?
Well, it's a matter of education and awareness. And then there's the issue of, for the longest time, CPR has been around for 60 plus years. And the challenge has been for people that educate people in CPR is to get them to take the class or learn it and do it. And there's reasons that doesn't happen, and I classify them in two categories: fear and lack. And the fears are fear of stranger contact, fear of mouth-to-mouth contact, fear of infectious disease, fear of doing it wrong.
There you go. Fear of making a big mess of it, and
Right.
and sometimes in today's litigious culture, being held responsible.
Fear of being sued.
Yeah, for
there's
something.
no recorded instance of a successful lawsuit against somebody for starting CPR, although there are many for not starting CPR.
Oh, well, that's good. That is good to know.
So the fear of legal liability or
Yeah.
being sued is not based in fact. There's been no successful lawsuits of people being sued for starting CPR.
Okay, so now we really have no excuses.
And then the lack part, I mentioned too, lack of education as to the risk of sudden cardiac arrest, lack of education as to what it looks like, lack of rescuer confidence, and the one I'd like to point out is what I refer to as cultural conditioning and role assumptions. Lay people assume that all they need to do is call 911 and then wait. And what Better Outcomes is trying to say is you're part of the rescue team. The bystander, the witness, is part of the resuscitation, is part of the rescue team. The victim depends on you to recognize they're in cardiac arrest, to start the CPR, and if an AED is available, to get the AED. That's part of the chain of survival and the response team instead of, I'll just call and wait.
And when we learn, we'll feel better about doing all of that.
Yes.
Now, I understand that most of these occur in the home.
Yeah.
I understand this actually took place in our building.
But to address your earlier point, the majority occur at home. 70% of all out-of-hospital cardiac arrests occur in the home, and that's where the CPR needs to happen, and it's not happening. But to address the one you're talking about, this was put on the Fulton County webpage. Russell
I remember now.
Russell Fleming, who works in the finance department, it was last fall in 2014. was just having his lunch, and it came to his attention somehow that a coworker went into cardiac arrest. Well, based on the skills that he learned as being a Fulton County floor leader, that's what it's called, he started CPR, did CPR for over 15 minutes. I'm not sure about the AED, but over 15 minutes until paramedics arrived, and the victim survived full recovery.
And believe it or not, lots of us got to watch that. And you're talking about something miraculous to see. Well, we're going to take a quick break. And when we return, Mr. Charles will teach me how to perform CPR. I'm going to get a taste of my own medicine. We'll be back in just a moment. And welcome back to Healthline. I'm Lynn Vaughn. Now, I want all of you at home to get your kids' dolls. Kids, get your own dolls. Place them on the floor and get ready. We're demonstrating how to perform CPR. Our guest is Michael Charles with the Better Outcomes Foundation. He's brought along some practice dummies, and he's going to give us some instructions. So, Michael, I'm all set to go if you are.
Great, I am.
Okay, let's go.
The first thing we're going to do is determine and recognize that the person actually is in sudden cardiac arrest.
Okay.
And we're going to do that, typically going to be on the ground, eyes closed, not moving. Well, it could be something other than cardiac arrest, so we're going to tap and shout. We're going to say, sir, ma'am, whatever, are you okay, are you okay? If there's no response, we're going to assume that they're in distress and they need 911, so you're going to ask somebody to go call 911 if you have somebody with you and get an automatic external defibrillator, okay? So while that's happening, you're looking for any signs of circulation or breathing, all right? So I'm looking, I don't see any movement. I don't see any movement in the chest. Color's not good. There's no, I'm going to start with compression.
Okay.
Right? So I'm going to find my landmarks by taking two fingers and put them where the rib cage comes together. I'm going to take my top hand, the palm of it, and put it right beside those two fingers and in the groove between the breast of the victim. I'm going to bring my bottom hand on top of my other hand, bring my shoulders up over the top of the victim, lock my elbows, and start compressing at a rate of at least 100, no more than 120 a minute.
Okay, and our dummy is letting us know how well we're doing, right?
These particular mannequins have a feedback device of lights on the left shoulder, and if you're doing it the correct depth and the correct rate, you'll get 2 green lights, which you do, which you have.
I got my green lights, and then it turned to yellow. What did that mean?
Well, either you slowed down or your depth was not deep enough. So you want to go at least 2 inches and keep the rate at least 100 to 120.
And what do I look for? As I've done this, what should I see the person doing? Should I see a reaction?
Not right away, probably not right away.
Okay.
So when you get to the end of 30 compressions, try 30. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Stop. You come to the head, open up, tilt the head back, chin up, opening the airway. Put your mouth on the victim's mouth and blow twice. Let it come out.
Okay.
You blow again. Very good. Tilt the head back a little bit more.
Oh.
Very good. Go ahead. And you're getting chest rise. Excellent. And you come back and find your landmark again. Put your top hand by the bottom hand. And you go another round. 1, 2, 3, 4. Now, you don't have to go the whole time because it's exhausting.
Oh, good.
But 2 minutes is the max.
Okay.
Even when professional firefighters are doing compressions, they're limited to 2 minutes because studies have shown that the quality of your compressions deteriorate after 2 minutes. No matter how big and strong and tough you are, even as a firefighter, they start to go downhill.
And especially
so you swap
in an
out.
emergency situation.
Right. So you swap out. And of course, if you're by yourself, you're by yourself. But if you have other people there, then you swap out after 2 minutes so that you can rest. They do it for 2 minutes, and then another person, or you get back in there and do it for 2 minutes. So there's 6, and by hopefully 8 to 10 minutes, the fire department will be there, and you'll get a break.
Now let's address that fear that some people have of stranger contact.
Okay.
I noticed that in the training, you have some tape here to help people learn how to do this and comfortably.
Well,
I mean, you're not going to have tape.
Sure.
In an emergency, but...
And the tape is actually a mouthpiece connected to the lungs so we can get some chest rise. That's what that's about.
Oh,
But it's
okay.
also a barrier device for not to cross-contaminate the mannequins. But let's talk about real people. One of those fears, as you said, is stranger contact, mouth-to-mouth infectious disease. And for that reason, the American Heart Association in 2008 introduced the concept of hands-only CPR, which you may have heard of. And the idea here is if the rescuer if the air rescuer is trained and knows how to do traditional CPR, the compression and the ventilation is great. If they don't know and they're not trained or they don't have the confidence or they have that fear, it's better to do something than nothing. So the something is compressions only. So we're going to skip the ventilations altogether. We encourage rescuers to recognize they're in sudden cardiac arrest and go straight for the compressions and just keep going. There is no 30 and 2. Just keep going for 2 minutes straight.
And when you get a reaction, then what?
Well, you're gonna stop, but we don't want lay people to check for a pulse because of the inaccuracy and unreliability of that. Just keep going until you see the patient start to breathe again or start to move again or start to resist you. Now, there's a device that helps with that. We talked about CPR as being pivotal in survival, but the other component is the AED. So someone has brought an AED, hopefully in the 2 minutes that you've been doing CPR.
Yes, and we have plenty of them here in Fulton County.
Great.
Every
public building has one.
Oh, okay.
I mean, Fulton County government public building.
Yes.
Yeah. So the AED is self-explanatory. All you have to do is turn it on and listen for the instruction. Now, this is a trainer device, and it's going to tell you that. A real AED would not say that, but here we go.
This is a training device only.
It can't shock you.
No shock will be delivered.
So don't worry about that. All right.
So it tells us.
Remove clothing from person's
So if they had a shirt on or blouse on, you would take that off because the pads have to stick to the skin.
Okay.
So it told me to do that.
Attach pads firmly to person's chest.
Here's the pads. It has a diagram of where to put them. So we're going to put.
This is my.
Yes.
Just this little one?
Yeah.
Oh, the whole thing.
The whole thing.
Okay.
I'm going to put that in the top right hand.
Right here.
Chest, just like it says. We're going to put this underneath the left armpit, just like it shows. Go ahead.
Left armpit.
Yeah, you're doing great.
Okay.
Check connector
and it's telling you to put the connector in. There's only one place it goes. It's flashing for you.
Analyzing rhythm.
And now it does its thing.
Everyone stand clear.
It's seeing if there's anything to shock. We'll see what it finds. So it takes a few seconds.
Okay.
Shock advised.
Oh, it found something to shock.
Okay.
It's going to charge itself up.
Clear.
You don't want to be touching the patient, anybody touching the patient, so you don't want to deliver an inadvertent shock to them.
Everyone
And this will flash and it'll tell you when to press the button. Push the shock button. Where's flash?
Shock delivered.
There you go.
Begin 5 cycles of CPR.
And you go back.
Go back to
Do
our.
the CPR, right?
Even with the pads on.
Oh yes.
Okay.
Because you don't want to interrupt compressions more than 10 seconds. You're good. You don't want to interrupt compressions more than 10 seconds because you lose the gains that you had. Now it said to shock. You ask, how can you tell if the person comes around? The AED will determine if the pulse is returned better than you can determine with your own fingers. So if a shock wasn't advised, the main reason might be because the pulse has returned. The other reason is not everything is shockable. So it'll tell you to check. But if the pulse returns, it'll tell you no shock advised. Check airway, check breathing, check for pulse.
Okay.
So that's why. But just keep going. It's better to deliver the compressions when they're not needed than to withhold them and they be needed.
Now, we have learned on an adult
Right.
patient. So what about children?
Children.
And then later on we'll talk about infants.
Sure. And children.
I'm going to sit down.
Absolutely, please relax.
Because these knees aren't what they used to be.
Tell me about it. So
Okay.
the steps are the same, but the technique is a little bit different on children. And children are defined as above 1 year old to about the age of puberty, which is different for different people. So depending on the size of the child, a smaller child, you're going to use one hand. So the technique is the same, or the steps are the same. The technique is a little bit different. I'm just going to use one hand, but my depth and my rate are the same. Other than that,
Now, I'm
it's all
a
the
smaller
same.
person, so I might have to use two.
You might. Either if you're the smaller person or if you have a 2-year-old, you'd use one hand. If you had
Right.
an 8-year-old, you'd
Or-
probably use two. Or
right.
11, depending on, it's not so much an age, it's a size-driven thing. So if 2 hands are more effective because the victim is larger, then you use 2. If they're smaller, 2 years old, 3 years old, 4 years old, then you use one hand. But the rate is the same, and the depth is about half the depth of the chest
I
cavity.
think I better try that. Give me a hand.
Sure. I would bring
Give
it
me
to
a
you.
hand.
Yeah. I'm going to bring it
There
to
we
you.
go. No, I'm okay.
Okay.
I'm good. So, wait a minute.
Square yourself up.
Oh, square up. Okay, and we would.
Same landmarks, same location, just one hand. Right, try this. Try using your 2 fingers here,
2 fingers.
just like before, on the bottom hand, right? Take the top hand right in between, right beside it. There you go. Bring your shoulders up over the victim. Lock your elbows. Remove that
There
hand.
we go.
Remove that hand. Remove that because you're doing one hand. Remember, as a child, one hand. Go ahead. Now go.
There
You
we
hear that
go.
sound? That sound's also a feedback mechanism. So you need to hear that
Okay.
sound when you're doing the compressions plus the light. So that's the difference in
Okay.
the child depending on the size.
Okay, and we have our infants with us.
Right.
Our little babies.
There.
I'm tempted to name all of my patients.
You're welcome to
here.
do that.
Okay. Oh, here we go, little one.
So now again, the steps are the same. And by the way, hands-only CPR is only recommended for adults and teens. So 13 and up is good hands-only CPR. Infants and people under 12, it's traditional mouth-to-mouth and the compression. So we're going to
Okay.
have to do mouth-to-mouth on the babies, all right? So
We don't.
We do
Oh, we
mouth-to-mouth. Yeah,
do?
yeah, yeah.
Okay.
Yeah,
For the babies.
The infants and the kids under 12 and under, you do mouth-to-mouth.
Okay.
Okay, because the hands-only doesn't work as well on them. Okay, so it's the same thing. You find an unresponsive child, baby, you're all right. You go call 911, and there are AEDs for kids. Get the AED. So we have an unresponsive infant, apparently. We're going to tap the bottom of their feet because babies don't like their feet to be messed with. And so you'll get, if you don't
I
get a
didn't know that.
Oh, yeah, it's
Okay.
very irritating to them. That's why you do it at the feet. If you don't get a
Okay.
response, you assume they're unresponsive. You go call 911 and get an AED. If you're by yourself, you go to the phone, but these days everybody has a cell phone. You just reach in your pocket on your hip and you call 911. So
911.
so that's done. Now, we're looking for signs of circulation. We find none. We're going to start with compressions. Now, this is not, of course, one hand. That's too large. We're going to use either
Two fingers.
two fingers between the nipple lines, like so, or an easier way to do it. Now, you sort of need a flat surface to do it on that. But
Okay.
here's an easier way to do it, and you don't need a flat surface. The two thumbs technique. You're going to encircle the infant with your hands and bring your thumbs together right there in the same place between the nipple line. Your fingers in the back are going to give you a resistance, and you start compressing. Now, the feedback mechanism, push the button on the diaper. Look at that. And now you can look and do your compressions and get 2 green lights,
Got 'em.
and you know you're doing it correctly. So you
Okay.
do 30 of those, you open the airway, you give your breaths, chest rise, you're in business.
Fascinating, wonderful. Thank you so much.
Thank you for having me.
This is wonderful. We will be right back with some final thoughts after taking a breath and a break. I certainly hope this information has proved useful and helpful to you. You know, heart disease is killing us. So learning how to use one of these, an AED, automated external defibrillator, and learning how to perform CPR are skills worth having in today's world. In 2014, there were more than 1,400 heart disease deaths in Fulton County. But CPR and AEDs can help reduce that number in the future by saving lives. Now, to learn more about performing CPR or to schedule an instructor like the great Mr. Charles here to come out and show you how to do it, he'll come to an event and give you a demonstration. Visit the Better Outcomes Facebook page at facebook.com/Better Outcomes Foundation or call 404-599-8013. I'm Lynn Vaughn. Thank you so much for being with us, and we'll see you next time on Healthline.